the output of every AI model or LLM model is some form of a probability statement. It could vary, but it's essentially a probability statement. And there's compelling and overwhelming data that clinicians are horrible at interpreting probabilities. I mean, absolutely horrible. We make bad decisions all the time because we don't understand it. And there's been some research, not in AI, but just in general. Much of it comes, a great book called Risk Savvy that comes out of the Max Planck Institute, showing that if you show physicians graphics like of 100 little stick figures, and when you shade in what would be the equivalent of the probability, they make much better reasoning than if you say, okay, this has a 50% probability, this has a 30, how do I make a decision? And I think there's been way too little research or even just evaluation of how do I present the output and how do I build trust so clinicians will use it? Because I was part of the development of the TRUE score. That was probably one of the most, impactful sepsis scores. And it has like a AUC of like 0.94. I mean, it performs really well, but none of the clinicians would use it because it was like this black box, and they're making a clinical decision that's life or death. And there was no work to trust it. And I think it's never going to be acceptable to say, trust the model because it's my license on the line or it's the patient's life on the line. That we're going to need a set of rules about how these models perform that say, what did I test it? How did I perform? Who did I do it on?